This in from the Minnesota Nurses Association. Members of their association today testified in support of keeping the Nurses at Bedside Act. During the bill's first committee hearing before the House Health Policy and Finance Committee, the bill introduced last week would address the short staffing and retention crisis to protect patient care in Minnesota by establishing local hospital-based committees of nurses and managers who would work together to set staffing levels on a unit-by-unit basis. The bill would also fund grants to support mental health for nurses and to prevent workplace violence. It would help to recruit and retain the next generation of nurses with new funding for loan forgiveness programs. Here's some of that testimony.
Good afternoon. My name is Mary C. Turner. I'm the elected president of the Minnesota Nurses Association, which represents 22,000 nurses across the state, 80% of all bedside hospital nurses in Minnesota. I am also a COVID ICU nurse at North Memorial Hospital in Robbinsdale, Minnesota. From my own experience and the nurses I talk to every day, I know that we are at a critical moment for our healthcare system in Minnesota. There's a crisis in our hospitals. Nurses are overworked and overwhelmed. Hospitals are understaffed and patients are overcharged because hospital management is putting patient care in the backseat to their bottom lines. But let me be clear, the COVID-19 pandemic did not create these problems. For over a decade, I and my fellow nurses have been raising the alarm about understaffing in our hospitals and the effect on patient care and safety. The pandemic has made clear to the public what nurses have been saying for so long, that we are in desperate need of action to put patient care and the hospital workers ahead of the profits of hospital executives. There are more than enough registered nurses in Minnesota to fill the need in our hospitals, and the number of registered nurses is growing every year. In a survey of our nurses, over 75% responded that they wanted to keep on working for the near future despite the pandemic. But short staffing and cost cutting by hospital management are driving us away from the bedside. Over 2/3 stated that they had considered leaving the bedside or knew someone who had because of the effects of short staffing on patient care and working conditions. This is a retention crisis, which hospital management created and has the power to solve. As president of Minnesota Nurses Association, I hear from nurses all over the state every day. And they have told me that this is a problem everywhere in Minnesota. Corporate healthcare systems have bought out local hospitals in greater Minnesota, replacing their community care model with profit-first approach to healthcare. The result has been closures, cutbacks, and understaffing, like we see everywhere at the hands of the healthcare executives. The Keeping Nurses at the Bedside Act is our best chance to stabilize our healthcare system in Minnesota. And let me be clear, this is not a state mandate ratio bill. It is not a one-size-fits-all solution. It is a hyper-local proposal which would put nurses and hospital managers at the table together to set staff levels, which will help nurses stay on the job to provide safe, excellent care that our patients deserve. And it would provide funding for mental health services and loan forgiveness programs to help recruit and retain more nurses for the future. I want to thank you for the opportunity to testify this afternoon.
In its statement, the Minnesota Nursing Association goes on to say, quote, "If the Keeping Nurses at the Bedside Act is passed into law, nurses will stay on and return to the job and patient care will improve. There is no shortage of Minnesota nurses who want to provide safe, high-quality care to their patients. There is a shortage of nurses willing and able to work under these conditions. Hospital CEOs making millions in compensation and benefits can afford to make changes to protect workers and put patients before profits," unquote. I'm Neil Carlson reporting for iNewZ.TV.